We saw with the COVID-19 pandemic that systems could not surge to meet the demands that were placed on them by the health emergency, by COVID-19. And it is very common that in major health emergencies, systems cannot meet those demands and continue providing essential services. The DG thought it was a fabulous idea, that of having peers reviewing each other, a dialogue, intergovernmental dialogue between member states that would bring forward their issues around their health emergency preparedness, as well as issues around accountability to their populations, to each other, as well as build a mutual trust between countries, and a key aspect of solidarity.
So when you have the Universal Health Preparedness Review, a review that looks at the level of preparedness to respond to shocks, what's under there is you need a system that is already strong enough to be able to deliver services during times of peace, but is also able to deliver essential services during shocks like health emergencies.
The reviews are actually very important in the African region, because what we need to do is ensure that we can strengthen countries to basically take the shocks of pandemics, epidemics, and outbreaks.
Ebola in West Africa in 2014 to 2015 caught us by surprise, and the consequence of that for us as a nation was quite devastating. So we vowed as a nation that we will do everything we can to not be caught by surprise anymore. Going forward, we think, how do we look at preparedness in a slightly different way? Instead of waiting for the next pandemic or epidemic to come through, how do we look at strengthening the healthcare system itself, based on primary healthcare, based on the principles of universal health coverage?
Countries have been delivering healthcare using different models, and the approach that Sierra Leone is looking at now is very important because it doesn't focus on specific diseases like HIV on its own, TB, or malaria, but it focuses on the person who needs the service.
We thought we should be able to test the system and see how effective it is, and by inviting the UHPR to come to Sierra Leone and let us work on it.
I'm very pleased that you are here. Our commitment to dealing with health issues is very strong. As a matter of fact, our human capital development agenda, this is one of the biggest pillars. We have defined human capital to mean health, food security, and education combined. With the support of partners, we've been able to actually realize some very useful gains in the health sector. So, of course, with the support, we can do more, especially with the knowledge that you are giving us to say that yes, you are heading in the right direction. We just need to intensify our activities, so that we can have better results and share them with the world.
It has been elevated to the highest level, right from the president, the vice president, to the chief minister, the speaker of parliament. So it's no longer a health sector thing, it's a multi-sector, a whole of government, a whole of society approach to health at this moment.
as a backbone of our healthcare delivery system. It provides an excellent nexus among universal health coverage, healthcare resilience, and global health security. The emphasis for us today is on providing high-quality healthcare for the entire population, which is the fundamental pillar of the vision of His Excellency for human capital development.
We've had a very positive stay here, interaction, and we have been very impressed at the government response and interest in the work that we're doing, particularly Universal Health Preparedness Review.
And it's just been a joy to look at some of the gaps that we have, some of the strengths that we have, some of the opportunities that are presented, and how we could work to make the healthcare system in Sierra Leone even better, even stronger, and ensure that we have a health security system that's able to detect things early, prevent it when necessary, and also respond much more effectively, much more quickly to contain it.